Tonight,
he's got a traumatic brain injury.
a head-on collision leaves a man fighting for his life.
We have to presume he's bleeding in his brain.
Multiple in a nightclub.
Hey, right, my name's with the ambulance, mate, all right?
A child has a deadly allergic reaction.
Can you do this medical alert? This swelling is getting more pronounced.
And a motorbike accident leaves a man in agony.
Well, just keep it in mind, open pelvis.
So I've checked the critical care drugs. I'm happy with those.
Lovely.
You've got all your armoury there, Mark.
That's fine, I'm happy.
It's Saturday night in Oldbury, and Dr. Mark Nash and critical care paramedic Colin Apps are about to start a 12-hour shift.
You could argue that Saturday nights people are out, more likely to be out having a drink, enjoying themselves, and therefore later on in the evening we might get some fights. Road accidents increase when people have been out drinking, but yes, there are possibly certain patterns to what we might see on a Saturday, but we will go open-minded to everything like we always do and see what happens.
Ambulance service, is the patient breathing?
I'm a taxi driver. I've seen a just accident on by the mosque before the roundabout.
Okay, and how many vehicles are involved?
Just only one vehicle. Is there someone in there as well?
Is the person breathing?
1 second. Hello?
Hello, is the patient breathing and conscious?
No. There's one patient. He's grunting. His hands are cold.
Is he awake?
No.
Okay.
Non-responsive.
Is somebody starting CPR?
Yeah.
Is he trapped within the car?
I think you'll need to take the roof off to get him out.
We're coming on blue lights and sirens as quick as we can, okay?
No, that's all safe, thank you.
Police, fire brigade and the ambulance service are all en route to the scene. But with a man's life in danger, Mark and Colin are also needed.
Never good, never good. Road traffic accident, I think car versus wall. Mixture of things coming through, giving us unconscious and giving us cardiac arrest.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Please, some fire to my location.
Sounds a bit panicked.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
No, it's on scene.
What does that mean?
So there are cars in front of this thing. Just be aware there's people there. Yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Line across the car, GCS3.
Okay.
So we've ripped tonight.
Cheers.
Got a massive heading.
Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cool. You want to do drugs and yeah, cool.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here. I think we've got enough space here, haven't we?
Yeah, we do it here and then...
As they prepare to perform this major life-saving intervention...
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? Mark, they nearly got him strapped on, so we might as well just lift him up onto the...
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Cole, you can just stay there, just rotate round, can't you?
ambulance service, the patient breathing.
I've got two. I've got two. Yeah, two. One of my bitches is past me.
Sir, listen to me. I don't know if I'm to breathe.
Please help me, man. My bitches are dying, man. Please. Hey guys, so yeah, we've got that something at a double in Wolverhampton. We're running on channel 81. If you're over the clear and start heading that way, that would be great.
Yeah, send it on us, mate. We're good to go. I'll change over channel now.
Police and ambulance have been dispatched to the nightclub where the attacks have taken place. Reducing the number of deaths from is one of the critical care team's main objectives. So paramedic Ian Locke and Dr. Ravi Chauhan are also en route.
The fight is still going on at this location, so offenders still on scene, fight going on in the background.
For Ian and Ravi, being called to a is far from unusual. In the West Midlands, there are around 60 a week.
Well, so the update from there is there's a large fight and reports of 2 people. The fight is apparently still ongoing. So.
With the attackers still believed to be on scene, Ian and Ravi wait until the police give them the all clear. West Midlands Ambulance Service deal with around 1,000 casualties from road traffic incidents every year.
I've lost count of the amount of fatal RTCs that I've been to in my ambulance service career.
Rescuing the injured in these fast-moving, dangerous environments relies on absolute teamwork from police, fire brigade, ambulance and the critical care team.
We've got 2 OMs running on this and a total of 3 DMAs and yourself, over.
Working with other services, you know, that it's not just like one person, it's just like everybody doing like a little bit. And actually, when you sort of step back and you see it all sort of unfolding, it is really good. And like, they're like some of the best in the country, so you can't really ask for a better bunch to work with.
Check the battery on this before we do anything else. Battery's full, that's good.
39-year-old Pete Edwards has been part of the critical care team for the past 2 years. Like all team members, his specialist training means Pete has the skills and equipment to treat critically ill patients, often making the difference between life and death.
This is something that you'd see in hospital every day, you know, this sort of equipment, as are these ventilators that we have in this blue bag. You know, it's stuff that's frequently used in hospital, and it's now coming into the pre-hospital setting as well. This can be used to take away human error sometimes, or to free up a pair of hands. You know, you don't have to focus while this is doing what it's set up to do. You can concentrate on something else, so quite handy.
Ambulance service, is the patient breathing?
Yes, he is breathing. A motorcyclist has been thrown off his motorbike, literally hit the other lane. His bike hit the central reservation. He's actually in the opposite side of the road, going the opposite way. He's not moved since he's been knocked over.
No. And he's still in the other lane, he's still in the middle of the road.
He is, yeah, he is. He's in the middle of the road, lying on the floor in the oncoming traffic. He is breathing, but he's in a lot of pain. He can't feel his hip. Pain in his right shoulder, right knee, right hip, and left knee.
Has he taken his helmet off?
No, we haven't. It's still on. Yeah, is that good?
Yes, leave the helmet on.
A serious motorcycle versus car accident can be a code red emergency. An ambulance has been sent, but critical care backup is also needed.
Minimal protection on a motorcycle. I mean, the head's obviously protected with a helmet, but the rest of the body's exposed, and even the helmet, I mean, with a decent enough impact, it'll still cause a really significant head injury. Some of the things we always look out for with a motorcyclist is a fractured pelvis, because that can be quite rapidly life-threatening. How you doing, all right?
So we've got Ian here.
Ian. Hello, Ian. I'm Pete, one of the CCPs.
So at the moment we're complaining of right shoulder pain. That's his biggest pain area that he's got at the moment.
Yep.
Right hip, left knee.
On the busy A34, a car caused 53-year-old wire fitter Ian to hit the curb, throwing him off his bike across the grass verge, narrowly missing the oncoming traffic.
I know it's painful. I'm ever so sorry. We need to get you out of the cold. We're just going to lift you up, get you in the warm, we'll get you something for the pain, mate, all right? He's come quite a distance off his bike.
The ambulance crew members have immobilised Ian's neck and spine. If he has broken his back, moving him risks damaging his spinal cord and leaving him with permanent disabilities.
I'm just going to let control know what's going on from the scene. 7062. Number of patients is 1 motorcyclist. So far complaining of pain in his right hip and right shoulder. We're just going to get him on the vehicle. We'll do a proper assessment once on board and get you an atmos shortly. Cheers. You all right, mate? Do you know him? Is he your dad? He's all right, OK? We've just got here, assessed. He's been knocked off his bike, but he's talking to us, he's conscious.
Ian's concerned son has arrived on scene. He was called by one of the witnesses to the accident.
Don't worry, we're going to look after him, all right? And we'll get him sorted. Ian, mate. Where's the most...
The slightest movement has Ian screaming in agony. The signs are this could be a very serious injury.
At the moment, I'm concerned about his pelvis because he's complaining of some pain in the hip on the right side. If anybody's in a position to start while they're stripping off, get some obs. Shall they? OK. We'll just keep it in mind, open pelvis.
An open book fracture of the pelvis is one of the deadliest injuries because the pelvis contains major blood vessels which, if damaged, can lead to significant blood loss and cause the patient to go into shock and die.
Yeah.
Your vehicle, did you come to see to the location, please?
Lots of flags.
Critical care paramedic Ian Locke and Dr. Ravi Chauhan are en route to a multiple. A fight has broken out at a crowded nightclub, leaving 2 victims in its wake.
Right, back away, or we're not going nowhere, yeah?
The scene is too dangerous and volatile for our crew to continue filming, but Ravi's body cam keeps recording the unfolding drama.
Cheers, buddy. All right, thanks, man.
Despite the danger to themselves, Ravi and Ian know if they don't treat their patients quickly, they could die.
He's got 2 stab wounds to his lower back.
OK, yeah.
There's one with a single stab wound to the upper thorax at the back.
OK.
There.
Buddy, hey, I'm on with the ambulance, mate, all right? Just have a little seat for me, just so we can have a look, mate, all right?
A single knife wound can sever a major artery, causing death within 5 minutes.
I am blessed, man. I am blessed. Not blessed, man. Not blessed. I'm talking here. I'm blessed here. I can walk. I can walk. I'm blessed. I can go home. I'm blessed. I can go home. I'm blessed.
2, there and there.
I know.
OK.
Just sit here for a second. Just sit here. All right. Just lean forward.
Put a little dressing on your back, all right, mate?
I'm all right, mate.
Yeah, but
You're not. You just...
Ian needs to check the first victim to determine whether his wounds are life-threatening.
All right, just relax for us, mate. OK.
But it's a tense and aggressive situation.
You know what's
Right, not now, you won't. Not now, buddy. Not now. Just relax. All right.
Just look. Just listen to us. Just sit down. All right. Let us just do what we need to do. All right.
The man has 2 and needs hospital attention, but Ian's assessed his life isn't in immediate danger.
You need to go to hospital, mate. You need to go to hospital. All right. You do, mate. You do. Yeah, we're just going to go and look at him, mate.
They move on to find and assess the other victim.
You're right, mate. Okay, yeah. What's happened? So he's been... He's got stuck right now. OK, fine. Just take this off for a second, mate.
What way there was?
Huh?
Just 1 second, please.
Yeah, just take the whole thing off.
Yo, who's that? the first aid, the ambulance. You can't be touching me like that. Calm down, man. Just relax. Boss, you can't be touching me like that. Okay, all right. Calm down.
The wound is close to both heart and left lung. At the very least, there's likely to be internal bleeding.
Just sit back for a second.
I can't.
Yeah, I need to just have a look.
Buddy, let him do his job. He needs to.
He's an ambulance, man.
He's checking that you've got no other injuries.
Are you alright? Are you finding it difficult to breathe?
I can't breathe.
Okay, alright.
I'm sorry.
That's all right. Sorry, I need you to sit back for a second.
Whoa, why there? No. Boss, it hurts.
Okay, it hurts on this side, yeah?
Hurts.
Okay, take a big breath in.
I ain't trying to bite,
Okay.
The wound may only be an inch wide, but Ravi knows it could have caused significant damage.
Keep that on for a second. You all right walking out?
I don't know.
All right, I'll get you a chair. If you get a chair, mate. He's got a left side. Okay. He's got worsening, like surgical emphysema, starting to swell around his back.
Okay. Ravi suspects the knife has punctured his patient's lung, a potentially fatal condition that could cause respiratory failure.
Listen, what I need you to do, I need you to get into this chair. Right, we need to get into the ambulance quickly. All right. All right. Sit back.
2 wounds, here and here, 1 right arm. Issues, he's been GCS15 throughout. Last blood pressure was that. He's had a gram of TXA, he's got IV access there. He needs to go on the back, he needs to go up to QE. I'll get some fluids and keep an eye on him.
Outside, Ian hands over one victim with multiple wounds to the ambulance crew.
Should we go with that one?
Both he and Ravi will travel in the other ambulance with the more seriously injured victim. They take him to the Queen Elizabeth Major Trauma Centre in Birmingham. He is one of 5 victims that are treated here every week.
I'm feeling a little bit precious this morning.
Starting his first shift back from holiday is critical care paramedic Ryan James.
So I'm hoping for a nice little relaxed shift, ease myself back into the working week. But you know, I would think with my luck, we're probably going to be pretty busy. Because it's always the case, isn't it? If you want a nice ease back into your working week, then it's never going to be. 7062.
Just checking you there, you checked and all of that business over.
Yep, I'm here, matey. Good to go. Look after me today. It's my first day back off my holiday. For safety.
Hello, you speak to the ambulance services for patient breathing.
Yeah, he just walked out and fell right over. He thinks he's broke his ankle. He slipped on the ground, it's wet.
And it's his ankle that he thinks is broken?
Yeah.
Has he got an obvious deformity?
Have you got an obvious deformity on it? The bone pops out. It's deformed.
Did he say it's going the other way?
He said it's deformed.
We will be there to him very shortly.
Okay then.
According to the update that I've just received, this gentleman has got a angulated, complicated fracture. Basically, his foot is facing a different way to where it should be facing. And we have got some alternative analgesia that the crews don't carry in the form of intravenous ketamine.
With complex fractures, there is a risk that the deformed broken bones are interfering with blood supply to his foot.
The crew's still not answering, so no updates for you, but I'll keep you running over.
6-2, Roger, also.
Ryan may have to perform an emergency intervention to realign the foot, an agonizing procedure that requires skilled use of high-strength sedatives.
What I should do is we're pulling up in about 30 seconds. We'll go and have a chat, see if we can assist.
It looks like he's not going to get the post-holiday easy ride he was hoping for.
Here we go.
The critical care team and Midlands Air Ambulance serves a population of over 6 million people.
Come through to 30 18-year-old male, jumped query fallen from an upstairs window.
It was set up following a study on trauma survival rates that found providing hospital-level care and decision-making at the roadside could save more lives.
Bringing the hospital to the patient, that has a really high impact on patients, such that you can get them to hospital in a much stronger and more stable position than they would otherwise have been.
In Wednesbury, 8 miles northwest of Birmingham.
Right, guys, so current plan, you're doing a grand job. What we're going to do in a minute is we're going to go up onto the trolley there.
Dr. Mark Nash and critical care paramedic Colin Apps are trying to save the life of a 38-year-old driver who is unconscious with a serious head trauma and may be suffering from a potentially fatal bleed on the brain.
Colin's going to be on the right-hand side with all the airway kit. What we're trying to do is we'll just move the monitor down to be alongside. Is that okay? Does it make sense? Yeah? Cool. So I'm going to do ketamine, sucks, and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Oh, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in it. There's the KY.
Succinylcholine and rocuronium are two fast-acting muscle relaxants that will temporarily paralyse the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now, we don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. You happy at the top end? Yep. Good.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. As if anything, he's doing abnormal flexion, isn't he? Right, monitor wise, just want to look at the monitor. So just run back on. So we've got ECG on. I'm about to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah, you can't take the mask off, I think.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything is very cold. It's a heart. Right, this is going to be a token 50. Okay, and sucks is going through now.
The dose of sucks will take a minute to take effect.
It's quite swollen.
Let me know when you're ready to...
Yeah, that's the drug kicking in. Quite slow circulation, right, actually.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralysed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, already?
Yeah, he's got just a large epiglottis.
Okay, boogie's through,
yeah,
ready for the tube.
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie out. Okay, right. There you go. Yeah, got good movement. Okay, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. Okay, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
Okay, Sats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
Right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So, male, unclear of the mechanism. There seems to be cars involved.
Mark updates controls so they can alert the hospital.
He has, looks like an open brain injury. As far as we can see, there's an injury to his back of his head, which definitely was a flap of skin, and so he's got a traumatic brain injury. So we have to presume he's bleeding in his brain. So he's now been RSI'd. ETA, I think we're going for 15 minutes. We'll say 15 minutes.
15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess. Once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there, the longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to the sick patients, work with the crews on infrequent events for them, but frequent for us.
12 miles away in Cosley,
hello,
critical care paramedic Ryan has just arrived at the home of a man who has badly broken his ankle. The bones are protruding through the skin.
What's happening? Hi, Adrian.
He slipped outside and he thinks his ankle displaced. He's not sure whether it's gone outwards or inwards.
Sure.
47-year-old Adrian lives with his parents. After he fell, he managed to drag himself back inside, and his father called 999.
Not the Sunday morning you were hoping for, then?
No, not really.
No.
Tatty's ready.
I know, I've just noticed you've got your Sunday roast all prepared, ready to go.
Knew we were coming, didn't we?
A complex open fracture must be quickly realigned to prevent serious infections and re-establish blood flow to the foot. It's a procedure Ryan has done many times.
He's clicked it 3 times back into alignment.
Have you actually? Yeah. What, before these ladies got here?
But today, his skills won't be needed.
Wow, mate, I can't believe you've put that back into alignment. You know. What made you do that, do you think? Was it just hurting too much, or?
Yeah, well, I thought I was trying to get up.
Yeah.
And I thought, I ain't going to get up without it blocked the way it was. So
yeah. How far angulated was it? How far? Really? Blimey. Back old school treatment. I don't even know why you needed us to arrive, really.
Adrian's dexterity has served him well. Incredibly, he managed to manipulate the bones back into alignment himself. A delicate and agonizing procedure that usually requires high-strength painkillers and sedatives.
You're a brave chap. I'm surprised you haven't just called a taxi and hobbled on in there. There you go. Right, hold that on your mouth and nose. Make a tight seal. That's it. And then just breathe that through. And then we'll get you to a state of mind where you're not worried about what we're doing, and then we can pop your foot on that splint and get you splinted. Do you want to do leg or splint?
Happy his pain-tolerant patient doesn't need any advanced pain relief, Ryan continues to give Adrian gas and air to take the edge off any discomfort he may feel.
Happy? I'll go above and below. You slide it up. Okay, just going to lift your leg up now, OK? Nice deep breaths. Nice colour, nice circulation. Keep going, keep going. You've got the old... that's it, on the other side. Right, what this is just going to do is just going to tighten up around your leg and go firm, OK?
To stop the bones coming out of alignment on the journey, the ankle is encased in a vacuum splint.
Ready, set, lift. That's it. Keep your arms in, mate. Happy? Ready, set, lower.
Once he's on the ambulance...
All right, ladies, take care. Nice to meet you. All the best, mate.
Ryan is happy to leave Adrian in the care of the crew while he gets ready for his next emergency.
He's clicked it 3 times back into normal alignment before the ambulance crew and myself got there. So pretty impressive, really. Strength of determination of Adrian to be able to have done that to himself, you know, is commendable. You don't see that very often.
Ambulance service, did the patient breathe in?
Yes, it's my 2-year-old daughter.
And what's the reason for the call today?
She cannot open eyes, full swelling on her face.
And it's her whole face that's swollen?
Whole face, especially eyes. Now she wants to sleep.
Okay, if you pick her up, does she go limp or floppy like a rag doll?
Oh, yes, everything.
Yeah. Everything's floppy?
Yeah.
Okay. Has she had a very severe allergic reaction before?
Never, ever.
We have got that help coming as quickly as we can.
Just investigate, patient has bilateral wheezes and evidence of facial swelling.
So have we got any history on this address, what they're allergic to, ever?
Can't see anything in the video, mate.
No worries.
An ambulance has been dispatched to the address, but a 22-month-old child suffering severe allergic reaction is a code red emergency, so critical care paramedic Steve Mason has also been scrambled.
If they've got facial swelling, you need to be concerned about, you know, the airway being closed and then that compromising the patient, because obviously they haven't got an airway, they can't breathe, and there's some abnormal soundings on this patient's lungs. So a wheeze can indicate that, you know, the airways are quite tight and constricted. So, well, it can be life-threatening.
The child's worried mother has reported her breathing is laboured. Steve knows in these emergencies, every second counts.
Ian, have you got any medical problems?
No.
And have you got any allergies?
No.
Can you lift your right leg up a little bit? Yeah? Nice, okay.
In Birmingham, Ian, a 53-year-old motorcyclist, has been thrown off his bike, and critical care paramedic Pete has not yet ruled out a fractured pelvis, which could be life-threatening.
Sorry, and your right leg? Is that any pain?
Yes.
Where?
Here.
Okay. I suspect it's more hip at the moment. He's moving all his limbs, he's lifting his legs, which is, because we were concerned about his pelvis, but he can lift his legs, which I think that's a positive sign in terms of hopefully it's more hip than it is a true pelvis injury. But where's that pain, Ian, in your hip?
Yeah, you got a...
And again for me.
Yeah.
Ian, can you turn this foot, can you turn it to the side? He's able to rotate it. Yeah. And this one, and can you try and lift it again a bit?
That hurts.
Where about? Okay, relax. He's holding his leg up. Okay. So like anatomically, he looks in line. His lung bones are intact. So if anything, since the time we've been with him, his heart rate has actually gone down.
Yeah.
So I think if that was pelvis and he was bleeding, you know, his heart rate would go up potentially. He'd look pale and sweaty. He's not. He can lift both legs, and I think the pain is more on the side. So I think that's more hip than it is a open pelvis.
Pete doesn't think this is a life-threatening open book pelvic fracture, but without the benefit of an X-ray, he can't rule out any other fractures.
That's it. I'll keep his. Probably there's another one here. Yeah. Which one, right?
Ian's right arm and shoulder are giving Pete cause for concern.
Bear with us, Ian. Is it the shoulder, Ian, that's the worst? Ian?
Yeah.
It's the shoulder, yeah?
You have to excuse my language, but I ain't gonna be quiet with it.
All right. Ian, bear with us. We're going to get you some pain relief as soon as we can get to one of your arms, mate, all right?
I mean, just in his position,
yeah,
it looks lower than the left
shoulder
at the minute.
He's got severe pain in his right shoulder, so I suspect he's got a fracture dislocation somewhere there.
Details of how the crash happened will help Pete understand his chest and shoulder injuries.
Rough idea, Ian. Do you know how fast you were going when you collided with a car?
No.
And did you go through the air or did you slide across the floor?
No, I hit the cone. As soon as I hit the cone, I lost it. Hit the cone, hit the curb, and then I just fell off the bike.
So you've just fallen off, you didn't go like flying through the air, you don't?
Yeah, hit the curb, or I just slid.
And it sent you up in the air, did it?
Yeah, you can see I don't know whether I went over the handlebars or I just couldn't save it.
Okay, no worries.
You can see the scrape marks, as I say, on the road.
Take a big deep breath in for me. And out.
Ian's breathing is normal, but he has a suspected dislocated shoulder and a hip injury.
Can I just confirm that with you? IV paracetamol, 07-2021. All right? Okay. And we found no other injuries, have we?
Pete contacts control, who will alert the hospital of Ian's arrival.
So, yeah, what I'll probably do then, we'll send him to Sandwell, and I think I don't need to travel. Bye-bye. OK, I'll leave you to it. All right, nice. Thanks a lot. All the best, Ian. Take care. See you now. He did have a lot of protective gear on, which is a good thing, but we still have to be really cautious about injuries and, you know, have a high suspicion. We're a bit concerned about his pelvis, but what we class as a true life-threatening open pelvis fracture, I think that's unlikely in his case. If he's got a shoulder dislocation or a fracture, we're going to get him to the nearest hospital, which is a trauma unit, so they'll be able to deal with him.
Hi, you all right?
Yeah. In Smethwick, Steve has just arrived at the house of 22-month-old Anit,
Every day, yeah.
who has a wheezing chest and an increasingly puffy face.
It's got a lot worse in the 10 minutes.
What has she sort of been allergic to, do you know?
All indications of a serious allergic reaction that needs emergency treatment.
The only thing that she's had is Weetabix.
Weetabix, okay.
We don't know anything else to, obviously, what it could be, but she had Weetabix last week and was fine, wasn't she?
Every day she had
Every day, yeah.
Driving, she had every day, so both things normal, never.
Has this happened before at all, or?
No, my
No.
other daughter had this reaction before, because she had a reaction from nuts, but not she, never had.
Okay.
After her usual breakfast, Anit's face started swelling and she became worryingly subdued, so her mum rang 999.
So we're happy with her sats at the moment.
Yeah.
So I think what we'll do, because unsure what's going on, if we just head to the children's now, yeah.
Although Anit seems very calm, allergic reactions in children can quickly escalate from mild itch to life-endangering anaphylactic shock.
We'll just take her in.
I just said it is quite a bad reaction now.
Okay, jump on. So there's nothing to worry about, Mum, okay? I'm just going to take him to the right hospital, just for reassess, okay? Okay. Yeah, whenever you're ready, yeah.
Can you sit there, please, Mum? Is that okay?
If her condition worsens, the best place for Anit to be is in hospital. so Steve decides to get her there as quickly as possible with minimum fuss and intervention.
Oh, dear me. Can you do this medical alert, please?
He will make the 3-mile journey to the nearest children's unit with Anit, calling control to prep the hospital for her arrival.
A 22-month-old. She's developed a sort of swelling to her eyes and to her sort of face area. This swelling is getting more pronounced, so we're just going to alert back into Sandwell, please. And we'll be at Sandwell in how long? In about 5 minutes. That's fine. And this is unlike her to be nice and calm like this. Yeah, so her eyes have developed since I've been here a little bit, yeah.
It's developed quite a bit.
Yeah, yeah. She just looks a bit uncomfortable with all the itching. If that swelling gets really bad, affects the tongue, closes off the airway, then you've got potential airway issue. You've got no oxygen going into that patient. If the airway completely occludes, then, you know, what we need to do is try and act on that quickly to sort of stop that. So you said your other child suffers with this?
Yeah.
What, has she been diagnosed with anything at all, or?
She had allergy from nuts sometimes.
Nuts?
This kind of allergy I seen on her.
Okay, and does she carry an EpiPen around with her? And no?
She's normally fit and fine, so the thing that just once she had allergy from that.
Okay, no worries.
In the last 5 years, the number of children hospitalised with life-threatening allergic reactions rose by 72%.
I'm concerned that she's got some swelling going on, so she's got a reaction to something. So whatever's going on, you know, it is looking at. She's a bit uncomfortable because she's scratching. You like camera,
Arriving in hospital, Anit is carried through to the waiting paediatric doctors.
Really, with that patient, I think the more we would have done to her, the more stressed she would have become. So, hands-off approach, let her watch something on the phone, and she was nice and calm all the way in. Then we just got her in, which was great.